Okay, let us dive into Chapter 10, Lifespan Development. This kind of talks about different changes in the body as we age. So humans kind of technically evolve over their lifespan. Paramedics must be aware of the changes that humans undergo at each stage of life, and we need to adjust our care based on the patient's needs, of course, and what their age. We don't treat a 1-year-old the same way we treat an 80-year-old, although in some ways we do. An infant is 1 month to 1 year of age. Younger than 1 month is commonly referred to as a newborn or a neonate. For infants, usually, in general, they weigh about 7.5 pounds at birth. They'll lose 5 to 10% of their body weight in the first week, and then they'll begin to gain weight from that point on. Just depends on the baby. Cardiovascular system, prior to birth, circulation occurs through the placenta. We don't need to get real deep into any of that stuff. We'll cover it all later in the pediatric chapters. And then as the baby is born, they switch to their own vasculature system. I think you talked about that. Yeah, those first few breaths that a baby takes as a newborn, there's so much that changes in the body. It's amazing. The pulmonary system really kicks in. You get that. Anyway, we're not going to get deep into that, but just know that there are a lot of changes that happen in the first few minutes of a child's birth. Really cool. Young infants are nose breathers, typically, and so under 6 months they are prone to nasal congestion because they are breathing mostly through their nose. The pulmonary system, compared to adults, they have softer rib cages. The diaphragm is a major respiratory muscle. They don't have very good intercostal muscles or accessory muscles. They're very weak, so they aren't able to compensate as well. They have a larger tongue in comparison to their mouth. They have a shorter and narrower airway, fewer alveoli, and they have very fragile lungs. We don't want to use a BVM on them very forcefully. We need to be very fragile with the kiddos, infants. Renal system, consider dehydration. That can happen very easily with them. They don't have, like we said, don't have much compensatory mechanism. Could have some electrolyte imbalances. One really cool thing is coming from the mom, and they get that passive immunity that helps protect them up to about a year of age. And as long as they're breastfeeding, they get more passive immunity that passes from the mom over to them. They get those antibodies through the milk. And then after 1 year of age, that passive immunity starts to decrease, and they develop their own immune system, and so they become very prone to sickness, and while they build that new immune system. The nervous system continues to evolve following birth. They are born with 4 different reflexes. You get the Moro reflex, palmar grasp, rooting reflex, and the sucking reflex. So the Moro reflex is the reflex when an infant is startled. He or she will open the arms up wide, spread the fingers, and they seem to kind of grasp at everything. Palmar grasp is whenever you put your little finger in the baby's hand and they try to grab your finger. You know, everybody thinks it's the cutest thing. Well, it's a reflex that babies are born with. The rooting reflex, when you touch a baby on their cheek, a lot of times they'll turn their head towards that, and it's kind of they're almost trying to suck at it. They do it even more so when they're hungry. That rooting reflex will become more so, and as they try to obtain milk and everything. Sucking reflex, if you touch their lips, they'll try to start sucking. Just another reflex they're born with. And they'll test those whenever the different reflexes whenever the patient's born. Us as an adults don't have any of those, and that's what we're focusing on, is just the differences between adults and infants. The nervous system, fontanelles allow the head to be molded. Sleep patterns are developed as we age. Fontanelles, the posterior fontanelle closes up about, I think it's like 3 months-ish is when that posterior fontanelle starts to close, and then the anterior fontanelle is closed by about 1.5 years old. Something cool with fontanelles, like, okay, so the purpose of that is whenever the baby's being squeezed out of the birth canal, it allows the head to move around and everything to be pretty pliable to get out. With the fontanelle, though, if a baby is dehydrated, then that you might have a sunken fontanelle, and you can actually feel that to assess your patient. On the other side of that, if a patient has increased intracranial pressure, that might have a bulging fontanelle, and that can show you, unfortunately, a lot of times it's associated with abuse if they have increased intracranial pressure. Just, I know we'll get all into that in the pediatric area, but just a little nugget for you. Sleep patterns are developed. Oh, babies and sleep, good grief. So it says in the notes that on average, most babies will be able to sleep for 5 hours by the age of 3 months. It's all going to be specific on the infant, their parenting style that they are receiving, all their environment. There's a lot of different factors that go into sleep patterns. Musculoskeletal system, you have growth plates in all your long bones where these babies and infants, kids, teenagers even, all have these growth plates, epiphyseal plates, that they're growing very quickly, and it's also possible if that is damaged while the child is growing, that it could damage it, and then they're stuck with a short bone because it can't grow anymore. Anyway. Growth charts will track the growth of an infant or children, provide percentiles comparing the child's growth to that of the average child of that age. Teething usually begins about 4 to 7 months. Baby teeth are in and by age 3, and then the permanent teeth usually come in around about the age of 6. Psychosocial development begins at birth, of course. So just a nice little table there to think of. A patient at 2 months old might recognize familiar faces, track objects with their eyes, whereas a 12-month-old will know his own name, answer, or respond at least to his or her name, and may or may not be able to walk at that age. My son started walking right at 12 months. But it's just good to know, like, at what to expect from your patients as you run these patients. You know, if you're running a 6-month-old, you shouldn't expect them to be able to crawl or, maybe crawl, but you shouldn't expect them to know how to walk or say words, stuff like that. Yeah. Infants typically have their own timetable for development. No 2 kids are the same, promise you. Bonding is based on a secure attachment, typically with a caregiver, a mother or father a lot of times. Anxious, avoidant attachment based on rejection. Anxious, avoidant attachment based on rejection. I don't have any nuggets for that, really. Most infants use crying as their primary method of communicating distress, whether that's hunger, thirst, dirty diaper, anything like that. Babies like to cry, just part of it. But as a mother or father or caregiver, then they may learn to understand what the different crying sounds mean, you know, different tones and pitches and stuff like that. For infants, a reaction to a stressful situation or situational crisis, if you will, follows 3 phases usually: protest phase, despair phase, and then withdrawal. So in that protest phase, you might get a lot of loud crying, irritability, restlessness, stuff like that. And then the despair phase is more of a monotonous wailing, just because the infant doesn't think the situation is going to change. And then you might get that withdrawal phase where the baby almost becomes apathetic and just kind of becomes bored with its environment. Infants need a predictable environment to feel secure. That is pretty important, and they learn to trust certain things. So just know that. Children may be easy, difficult, or slow to warm up, or a little bit combination of each. And depends a lot of times on what age they are. Anytime we can, of course, we need to let caregivers hold the infants and reduce that anxiety. Allows us to do a better assessment usually if they can kind of distract them and reassure them, keep them calm. Toddlers 1 to 2 years old, preschoolers are aged 3 to 5. Vital signs. You get a slower pulse and respiratory rate than infants, but it's still going to be markedly higher than adults. You might have a heart rate of 120, something like that, versus adult is 70 for a normal heart rate. Higher systolic blood pressure, of course, than an infant. Whoops. Cardiovascular system is similar to an adult, but lacks well-developed lung musculature, and kind of doesn't have the backup system or the longevity, and I can't think of the word right now. Not able to compensate. There you go, compensate, as long as an adult might be able to. They will again lose that passive immunity, and so they will become sick a lot as they develop their own antibodies, all that good stuff. They might have some weight gain that kind of levels off, or they might slow in their weight gain compared to an infant. Neuromuscular system, development of fine and gross and fine motor skills, more of the fine motor skills. Yeah. Brain weighs about 90% of a final adult weight. So they've gained about 90% of the brain formation anyways. And also their muscles are becoming fairly dense at this point and more like that of an adult. They will develop bladder control and bowel control, hopefully. Their renal system is continued to advance, and also their nervous system that gives them that feedback that they need to go to the bathroom is advancing, and that way they know when they need to go. Teething may be painful and include a fever, may be very miserable for the parents. And sensory development makes tickling fun or annoying, depends on the kid. Psychosocial changes, usually you get your separation anxiety that will peak around 1.5 years old, something like that, and then start to decline, and the kids will become more adventurous, I guess, a lot of times. Not so worried about being away from mom or dad and all that. Language development occurs. It's fun. It's a lot of fun. Usually by the age of 3 or so, they've got a basic language kind of down pat. They can usually form full sentences by about the age of 3, and they've got the basics. Peer interaction results in learning control, obedience, competitiveness, modeling behavior, recognizing sexual differences, male and female, all that. Modeling behavior, I will say, starts very young. Kids will imitate anything they see, and starting at the age of 1 or so, they'll imitate everything. Behaviors of parents and puppy dogs and everything else. So some tips for us: always include a parent or caregiver for us in our assessment. If they can hold them, whatever, to ease the anxiety. Position yourself at the patient's eye level. Explain what you're going to do. Save the worst for last, of course. Don't reason with a child about why you're going to do something. Just explain that you have to do it. I've got to start an IV on you. Don't give them the choice of, do you want me to start an IV on you? Or do you want me to take your blood pressure? Just say, hey, I've got to take your blood pressure. Or, you can word it differently. I've got to start an IV on you. And then do what you need to do. Of course, if you ask for their permission, they're going to say no. But it's got to be done. Development is a reflection of parents. A lot of times you get 3 different styles. You got authoritarian, authoritative, and permissive parenting styles. Authoritarian expects complete obedience, very demanding usually, very strict. Authoritative sets and enforces rules, but they also give freedom along with some guidance and authority. So it's kind of a balance. And then you have your permissive, which pretty much lets the kid do whatever they want to do. So you have authoritarian, which is very strict, versus permissive, which is very lax, and then authoritative is kind of in the middle. And also, it talks about reflection of the parents. Divorce has a very big effect on self-esteem and patient's sense of well-being, trust and mistrust, all that. Divorce does play a big role in childhood development. School-age kids, ages 6 to 12, vital signs and physical body approach those of an adult. You'll still have lower blood pressures and higher heart rates compared to an adult, but they're not going to be way crazy out of whack. They'll grow 5.5 to 7.7 pounds on average and 2 inches per year. Puberty may start at 12 years or younger, might be a little bit later, just depends on the person. They'll start to get those permanent teeth in, and you'll still have that maturation of the brain, still maturing. Psychosocial changes, you get 3 stages of reasoning. It's not just black and white now. You get actual reasoning that's happening there as the brain matures. You get pre-conventional, which is the idea to avoid punishment and yet get what they want. And you have conventional reasoning, involves acting to obtain approval from peers and society. And then you have post-conventional reasoning, which involves making decisions guided by a conscience, the patient's conscience. Patient's or child's sense of self-concept, which is their perception of themselves, will develop, and then a patient's or person's self-esteem also develops, which is how they feel about themselves and how they fit in with their peers. Self-esteem is more peer-based, whereas self-concept is just much more personal-based. Some tips for us: use the same techniques for preschoolers. Get caregivers involved. Gain and lose trust is a big issue with them. Usually if you make friends with them, establish that rapport, then it leads to better assessments. Be direct, assertive, and open. Like we talked about, don't give them the option usually of doing certain procedures. Just let them know what you're doing and do what you have to do. Adolescence, the old teenage years, ages 13 through 18. Typically, once you get into this age, vital signs are about the same as adults. You're going to start, when it comes to your treatments of like medication dosages, stuff like that, it's going to be the same as an adult. Their weights are similar to that of an adult. A lot of times they'll go through a growth spurt. There'll be lots of hormones involved. Muscle mass and bone density are pretty much the same as an adult at this point. And you'll start to get that sexual drive and lots of hormones, like I mentioned. Get the secondary sexual characteristics that start appearing, menstruation in the girls, lots of hormone secretion in both sexes. Psychosocial changes. You get family conflicts related to privacy, self-consciousness, rebelliousness, peer pressure, self-destructive behavior. Any of those things can affect how you treat the patient. They're usually very modesty-oriented, whether that be good or bad. So don't start stripping a patient down in front of their family, in front of mom and dad. Even at this point, they're kind of beyond that. They're wanting to stay modest or not show mom and dad like they used to. And so if you're able to get that patient in the back of the ambulance on a more, give them more privacy before you do those physical assessments that you have to do. And of course, if you don't have to do a real in-depth, detailed physical assessment, then try to avoid that. You don't want to put yourself in a weird, awkward situation, if you will. Let's see if there's anything else on that. That's it. Provide discretion and respect for the patient, like we kind of talked about. Speak with patients separately from caregivers whenever possible. They might not want to discuss stuff in front of their parents. Don't ask a patient if they're sexually active in front of their parents. Wait till you're in the back of the ambulance. Try to get one-on-one. Ask them about that stuff. Ask them about birth control. Asking them about alcohol use or drug use. They're not going to reveal any of that stuff in front of the parents or caregivers usually. But maybe on a one-on-one they might be more forthcoming with that information. Early adults. This is probably the majority of us going through this program right now, ages 19 through 40. Early adult at 40, it seems pretty old. Whatever. Vital signs remain constant. They say this is your peak physical fitness time is between 19 and 25, and then from 25, it's all downhill from there. Muscle strength decreases, your reflexes become slower, metabolism starts slowing, all that. After age 25, it's just all downhill. So it says. Work, family, and stress are main focus. There's a strong urge to settle down, seek love, have kids, all that fun stuff. It depends on the culture that you are in, I guess. It is typically considered one of the most stable life periods, which is hard to believe. Being in this age group here, I wouldn't think that'd be most stable. Lots of changes that happen. I mean, maybe if you're already settled down, I guess. It says here, fewer psychological problems than other stages. But all right, that's what we'll go with. Who am I to argue? I've never been a middle adult here. Ages 41 to 60. Well, this is when you really start going downhill, I guess. You get your vision and hearing loss, cardiovascular disease, lower metabolism, cancer rate increases, menopause. Oh boy. Psychosocial changes, focus on meeting life goals. Empty nest syndrome, once the kids are up and out of the house, it causes a whole nother adjustment to their whole living standard. Financial worries related to retirement, plan early. Anybody going through this? Start working on your retirement now. It's never too early, trust me. May see crisis as a challenge instead of a threat. And they're more able to overcome that and more willing to work through that versus just being threatened and scared away. Late adults, ages 61 and plus. These are the old folks. Life expectancy right now, I guess, is currently 78 years old. And the maximum lifespan for us is 115. So there you go. Vital signs depend on overall health status, medical conditions, and medications that they're currently on. You know what, I pretty much assume at this point, at least in the area that I work in and live in, every patient has diabetes, every patient has hypertension, and every patient has heart disease until proven otherwise. So you can show me a med list or there is no med list, or you can adamantly deny the history of any of those diseases, you've got them. Seems like everybody's got those things. That's in that age group anyways. Cardiovascular disease, you get atherosclerosis, which is a buildup of calcium and cholesterol there in the walls of the blood vessels, and it leads to blockage. Hearts are less able to deal with exercise or disease, don't have those compensatory mechanisms like you do as an early adult, so it becomes more like the infants, they aren't able to compensate. And the vascular system becomes very stiff. It's not able to fluctuate, and arteries aren't able to get bigger and smaller and adjust quite as easily. Respiratory system, structural changes make breathing more difficult. Everything's just more stiff, really. It's not as pliable as it used to be. Changes in the mouth and nose leave the upper airway less protective. A lot of times there's less mucus production. Weakening of the smooth muscles of the lower airway may lead to collapse even. And a lot of times you will have a decrease in alveoli as it becomes damaged as you age and stuff like that. Then you have a decrease in alveoli down in your lungs, so you aren't able to exchange air quite as well. Vital capacity of the lungs is significantly decreased and residual volume increases. So you got more dead airway space in there. You might have some hypercarbia and increased CO2 retention in the bloodstream, even if you're not a smoker. Endocrine system, diabetes related to weight gain, and then changes in the reproductive system. Like I said, everybody's diabetic unless proven otherwise, at least around here. And someone might not actually be diagnosed as diabetic, but they've been living with high blood sugar for years, and it can cause some mental status changes and some other medical conditions. Change in reproductive system. Usually the ladies are no longer fertile. Guys are fertile, but they might have trouble using their parts, if you will. And both sexes might have a decrease in sexual desire or drive. Renal system doesn't work quite as well as it used to. A lot of times there's a decrease in ability to sense that you need to go to the bathroom, and can lead to incontinence, whether it's bowels or urinary. And decrease, in the kidneys, you have those nephrons. There's a decrease in those, and they might be damaged or diseased at this point. So lots of changes that are going on as you get old. And what it all comes down to is, everything's just wearing out. It's getting tired. Gastrointestinal system, you have decreased sense of taste, weaker teeth, not able to chew as well, decreased saliva production, slower gastric motility, diminished acid secretion, decreased ability to extract nutrients, and fecal incontinence. Like I said, you have that urge, or you might not feel that urge that you need to go, so you end up having incontinence. Something I will say, with a lot of late adults, the incidence of obesity, I think, kind of goes down as you age, because you have that decreased sense of taste and you're not tempted as much. So a lot of times people will lose weight as they get older, really old. The nervous system. So the brain will lose weight, starts losing a lot of that mass, especially if it's not being used very much. The less you use it, a lot of times what you see is when patients or when people retire, they stop, pushing themselves. They stop really stimulating themselves on a mental level, and so they start losing neurons. You start seeing more and more Alzheimer's just because they're not using that stuff and they're losing it. And there might be some changes to sleep patterns. You might see people up all night and then sleeping all day. It's possible. Brains have an increased risk of injury because if you are losing that mass, it is more likely to move around some. You see on that picture on the left, you got that nice younger brain, and you see here it's fairly snug inside the cranial cavity, whereas here on the right-hand side of the older adult, you got lots of free space to move around. You might have some bridging veins that might tear. It's more likely to be damaged. Just not as strong as it once was. The nervous system, diminished sensation, diminished proprioception. It kind of leads to more and more falls and trauma. And deteriorating nerve endings can cause loss of sensitivity to heat and cold, sharp, wet, all that good stuff. And what it really boils down to is they're more likely to become injured and fall and stuff. I missed something? No. Vision changes. Pupils are less responsive to light. You get diminished visual acuity, restricted ocular movement, increased visual distortions. The lens gets thicker. All sorts of stuff. Older folks just can't see as well typically. Decreased peripheral vision. A lot of times if you add in diabetes to this as well, with that high blood sugar, those sugar in the blood is very, very sharp and damaging, and it can damage your eyes because it's kind of like causing micro lacerations. And so if you add in diabetes with being old, it can really, really damage your vision, if it's not very well controlled at least. You can't control the old age, but you can control the diabetes. Hearing changes, loss of high frequency hearing, might have some deafness, you might have to speak up. Don't automatically start yelling at the patients, but you might have to speak up. Loss of taste bud sensation and olfactory perception, like we talked about, loss of that sense of smell and taste. That's why they might not eat as much. Psychosocial changes. So they say the last 5 years before you die, you like decline the fastest, on average anyways. Those last 5 years, you lose the most brain function, and you can go downhill very rapidly. And you see that time and time again. You know, oh, this patient was fine a year ago. Now they're, you know, they don't even know their own name and stuff like that. It's like, well, this is not going to be good. People might not make it. Many late adults do live at home. Many of them also live in assisted living facilities. There's more and more of those coming up and around. Financial concerns, you might encounter that. And patients face their own mortality. A lot of times by this point, hopefully they're okay with mortality. You know, they realize that they've lived a good life and it might be nearing the end. But just some stuff to keep in mind, especially financial concerns. You know, yeah, it costs money to be transported by EMS a lot of times, and they might not want to pay that. Is that the end? That is the end. Oh, we're having so much fun. So, lifespan development, just so you know, you come out, lots of physical changes happen very rapidly in those first few breaths as an infant. You get better. Peak age is 19 to 25 according to this, and then it's all downhill from there. And then maybe someday you can go live in an assisted living facility and play cards all day, or whatever these nice folks are doing. So just be familiar with those, and yeah, have a good day.